My name is Henning. I'm the CEO of ImagineHealth, based in Thailand. ImagineHealth is the leading longevity facilitator here in Bangkok, and it's a bit of a culmination of my professional career. I've been working in regenerative medicine and healthcare since 2008, and it's always been about finding the expert physicians and the expert labs and promote them globally, right? So you can call it medical tourism, but it's really about talking to clients, finding out their problems, and going out there and finding innovative solutions in Asia. And ImagineHealth is basically doing that, but with a focus on longevity. We like to make sure that regular folks have access to these innovative therapies that otherwise are only accessible to the rich and famous.
Yes.
And things are changing, and we are a big part of the change. Come to Thailand, gain 5 to 10 years in biological age, and return back home. That's the vision of ImagineHealth.
My name is Hisham, Dr. Hisham. I'm a medical doctor, ex-emergency medicine physician, turned public health specialist, and I practice longevity medicine. I'm also the CEO and founder of ImagineHealth and Bartley Clinic, which is based in Singapore. Bartley Clinic is a bit unique in the sense that it is a primary care facility, primary care provider, but what we aim to do is actually infuse longevity medicine with that. And like ImagineHealth, we try and bring longevity medicine to the masses, right? Democratize it. So that's what we do.
Yeah, we at ImagineHealth are very excited about the collaboration with Dr. Hisham at Bartley Clinic, Singapore. Number one, I think it doesn't really have to be said, but we're both very passionate about making longevity medicine available to a wider audience of people. It's obviously a huge trend, but there is a lot of confusion and perhaps misinformation out there.
Yeah.
So education is the key. Furthermore, we are based in Thailand, you are based in Singapore, and this initiative is very much demand-driven. So we've had clients in Singapore that said, yeah, great, I want to come to Thailand. We may want to do some interventions on a cellular level, but who can I talk to in Singapore? Who can I talk to afterwards? So from that angle, it's a perfect marriage of Thailand and Singapore. Singaporeans usually are very highly educated. They have heard about certain interventions. They may already be biohackers, but then they are running out of options to actually utilize their knowledge and apply it. So rather than just traveling abroad and researching on their own, I think this partnership helps Singaporeans to have solid information and then also a solid set of options for their longevity.
A few of my patients, a number of my patients, you know, when they go through the longevity program at Bartley Clinic, right, they may require interventions which are not available in Singapore. Okay, regenerative therapy, right? So I've always been looking out for partners outside of Singapore who can provide that for my patients. Actually, Henning reached out to me first through LinkedIn, okay? And I thought, wonderful, right? Let's have a chat, right? Had a video call, you know, he came to Singapore, I came to Bangkok, met up, you know, and that's where the partnership, you know, began. Now, what I like about this is that ImagineHealth curates the program, you know, and sets the standards. So the standards is very important. And they have a team that can guide the patients on the ground here. So the patients are not left alone here in Bangkok, right, in Thailand. So they're guided every step of the way, which is what I need, because I do very personalized type of management for my patients, right? So, and whoever I partner with, I would assume, you know, that they do the same. You know? And Henning and his team in ImagineHealth fits the bill. So thank you.
Thank you. I can only return the compliments. So we've already had clients that are in your hands pre-treatment, and you know, they do the follow-ups, and now anti-aging or longevity medicine is no longer anecdotal.
Yes.
It becomes actually tangible, and
Yes.
it becomes numbers on a piece of paper, right? So we
Yes.
can set the baseline before traveling abroad,
Yes.
do the intervention, whatever it may be, and then they're back in your continuum of care, in your hands, and the journey continues, right?
Yes,
so
that's right.
we provide an add-on, maybe perhaps a missing puzzle piece
Yes.
in that Singaporean longevity journey. So ImagineHealth specializes in regenerative medicine and longevity medicine. What does that mean? That obviously is an umbrella term for many cellular medicine options, but of course one of the hero treatments we offer and promote at the moment is stem cell therapy. And I know there's a lot of confusion out there on stem cell therapy. It's very difficult for the end consumer to actually make sense of it. There are different stem cell types, different stem cell protocols. Some clinics follow a certain approach, some clinics follow another approach.
Yes.
So we help Dr. Hisham, but also our joint clients to make sense of all of this.
Yes.
And I've been working in the stem cell industry since 2008, regionally in Southeast Asia, mainland China, Hong Kong. So I have a very good overview about the stem cell providers in the region. And I can help our Singaporean clients to get to the right provider, to talk to the expert physician and get the right protocol, because everything is personalized and it's very complicated, especially for perhaps yet uneducated clients that have heard about stem cells, but they don't really necessarily mean what that entails and what does that mean.
That's right.
That's the education part. Yeah? So stem cells is huge. Singaporeans have to understand that Thailand has a very good framework for these type of therapies, and there are some really good physicians and a handful of really good labs, but try to go on the internet yourself and try to find them, it would be nearly impossible. So that's where we come in. We are a bit of a matchmaker in the longevity space, and yes, it's stem cells today, it could be gene therapy tomorrow. So stem cells today in 2024 is our hero product.
Yes.
I personally believe very much in it as a holistic longevity solution.
Here we go into a bit of the science of longevity medicine. I hope the viewers don't switch off now, right? So just bear with me, okay? So longevity medicine is based on the premise of two schools of thoughts, right? So one's lifespan and one is health span, okay? Both are actually interconnected, right? Okay, lifespan is the number of years you live, right? Health span is the number of years you live healthily, right? The two may not be the same. But what we are trying to do is try and match them as much as possible. So what happens as we age is that there's the hallmarks of aging, okay? You can look it up, what the few hallmarks are, but based in essence is that your cells deteriorate. Your cells deteriorate, right? Now, what do stem cells do, right? Everybody has stem cells. Okay, everybody has stem cells. They regenerate, right? They renew, right? Cells that have, not worked properly, right? Or in need of replacement. Okay, so the stem cells are there, but as you grow older, okay, the stem cells may not work as perfectly. This is where we do the stem cell replacement therapy, okay, which is quite unique and quite important. It's not currently available in Singapore, right? Okay, for many reasons. Right? So what my patients who need it, okay, do is that I will give them an option, okay, link them up with ImagineHealth, all right, who will then, facilitate that treatment for them here in Bangkok. My philosophy is that I always go and visit whoever provides the treatment for my patients, and I can say without a doubt that the quality is very high. The doctors are knowledgeable, okay, and the protocols are the ones that I, believe in as well. We've had a few patients where we've even turned down, actually, because they did not fit the bill, they did not need it, okay, or it was dangerous for them to have it, okay. So this is what I like about this partnership is the fact that we actually discuss it. It's not like, you've got a patient, we'll take it, kind of thing, yeah.
Yeah, you mentioned the hallmarks of aging, 12 of them, even
Yes.
though the numbers is growing. I heard there's going to be an extension to 15,
I know.
including community
It
and
changes,
other.
right? Yeah.
But we actually have a beautiful brochure highlighting how stem cells can positively impact every single hallmark
Yes,
of
yes,
aging.
that's right.
So please contact us after you watch this video, and
Yeah.
we'll share that with you, right?
Yeah.
Chronic inflammation is just one big aging trigger,
Yeah.
and stem cells are really potent in reducing the inflammation in your body.
That's right.
And
That's right.
just one more point. Some of the viewers may have done a biological age test. They may
Yes.
have heard it. The epigenetic tests you can do to perhaps find out your real biological age compared to your chronological age. And there's anecdotal evidence from these labs, from these test providers, that people who have done stem cells have seen a double-digit age decrease after stem cell therapy. So it's super potent, and yeah, that's just a message out there for all the biohackers who may not have a health concern just yet, but who want to just reverse their aging.
It's true, it's true. So I do a few biological clocks for my patients, right? So the ones that have done the treatments and therapies come back, and you can see there is definitely a marked improvement in their biological age, not going upwards, but going backwards, right? So that's one thing, but above that is the fact that, in terms of, organ function, in terms of bodily function, in terms of biomarkers, that there are improvement, right? So this is why, stem cells should be considered in terms of management of, longevity.
Safety is paramount. We mentioned it before. So number one, there's a very thorough review of every client. Number one in Singapore through you, but then also the files will be shared with regenerative medicine experts here in Thailand.
Yes.
Right? So it's definitely not me personally reviewing these cases. Number two, the stem cells that are being utilized at the moment are mesenchymal stem cells, and they have a very strong track record. Obviously, nothing is 100% in medicine, but there are hundreds of case studies and studies out there that have reviewed the safety part of it. Efficacy is another topic, but safety, mesenchymal stem cells are considered safe. Now, that's the theory. Of course, it all depends on the physicians, on the lab. So what can you do as a retail customer? At the end of the day, you have to trust the clinic, the physician, the lab. But fortunately, ImagineHealth and personally myself, we're here in Bangkok. And I've mentioned it, I've been in the space 15 years and in Thailand nearly 10 years. So I know every lab owner on a personal level. I know what accreditations they have domestically and internationally. And I know what kind of quality standards they're setting. Of course, every client's going to have a quality certificate for each batch of stem cells. That's one part, but there are so many more milestones from collection of the tissue all the way to the infusion in the clinic. And we're happily sharing this in great detail, in case you reach out to us, because that's a very important topic.
Success of the treatment is measured in three ways. One is actually how, it's very anecdotal, but how the patient feels, right?
Well, it's been like this for 20 years. People have always done these interventions, and they either feel better or they don't. And that has always been the big criticism for these elective longevity, or back then called anti-aging therapies. But things are changing.
Yes, that's right. But you cannot rely on that alone, right? Because it's subjective. It's subjective, right? How a person feels, right? For example, if you get an operation, right? Even though in terms of the operation may be a success, but you may not feel that it is a success, although to the doctor it is a success. Okay, so it's anecdotal. So that's one. Okay, I must say that so far no complaints, right, from the patients. Two, in terms of biomarkers itself, right? So there is a target, the improvement of organ function, reduction of inflammation, right? Improvement of basically immune responses and things like that. Okay, so that's one, biomarkers. The last thing is actually in terms of biological clocks itself. Now, I don't think all our patients have done a biological clock before and after, and I think this is something that we need to think about to incorporate that. Okay, biological clots are not cheap, by the way. Okay, but I think doing that as part of the program, it provides them with a lot more kind of evidence and information to then, we can tweak their management better.
Yeah.
Right. Okay. So those are the ways that we measure success.
Success stories in stem cells, too many to count and too many to all list them here in an interview, but I can tell you that my parents have done stem cells 3 times each. You mentioned the biological age test. My mom is 8 years younger than her chronological age, even though she's a lady that gets stressed out very quickly. So in that case, assuming we believe these biological age tests, there is a level of aging reversal.
Yeah.
I have seen hundreds of patients that have come to Asia for the treatment of chronic neurological diseases or autoimmune diseases. So too many to count, right? So I've seen it work in severely sick people.
Yes.
Even people with spinal cord injuries, people with ataxia.
Yeah.
People with ataxia that had a slurred speech or couldn't speak at all, and then the atrophy in the brain decreases, and certain abilities return. Ability of balance in people with balance issues, multiple sclerosis. So too many to list them all. But my point is, I've seen it work in the treatment of patients, in the treatment of sick people for many years, in the hundreds. It's not a miracle cure. It doesn't always work. It's also depending on the patient's, obviously, contribution in terms of PT and rehabilitation. But overall, it works. And I always knew that it works also in healthy people.
Yeah.
And nowadays, slowly, we start to see diagnostic tools that also make it tangible to see. And that actually is kind of boosting this whole longevity space.
That's right.
And it's lift-off time in that sense, because more and more people are able to get a baseline, maybe change the diet, start exercising, see how it slowly increases. But if you want to have a big jump, contact us, come to Thailand, and you return 10 years younger, biologically. Future of longevity medicine in Thailand. I actually, number one, I'm very passionate about it. I set up the company here for a reason. I actually believe that we can turn Thailand into a destination for longevity medicine. You think about South Korea, people think of plastic surgery. You think of Turkey, Europeans think of hair transplant and maybe veneers. Thailand, with everything it has, the hospitality, the weather, the hotels, but first and foremost, the labs and the physicians, we have everything. We have all the ingredients here to turn Thailand into a renowned holiday destination where you can not only collect the dopamine on the beach, but also collect a few years of life. And I think that is the story. And we have everything in place for that. And Singaporeans, 2 hours flight away, too easy. So I invite everyone to consider this option, come to Thailand and, gain a few years of life, healthy years.
That's right.
It's there. You just have to take that opportunity and contact Dr. Hisham or contact us directly, and we'll guide you.
The interest in longevity medicine is definitely increasing. I've been in longevity medicine for the past few years. When I first started, people were like going, what is that? Even myself, when I was approached by, other people who asked me to set up the first longevity clinic in Singapore, private longevity clinic in Singapore, I actually asked them, what is that, right? When I went into it, I thought, gosh, this is actually what I do, but more advanced. It's preventive medicine with a lot more sophisticated diagnostics, right? A lot more sophisticated management tools, treatments, pathways, and things like that. It's very personalized as well, which is what I like, because that's how I manage my patients, personalized. Now, there is also a lot of confusion when it comes to longevity medicine. So I think what will happen is that there will be increase in terms of research, right? Increase in terms of people who are interested in it, Now, hopefully affordability goes down, right? So affordability goes up, right? Not goes down, sorry, right? Access is there,
Yeah.
right? The other thing is that there needs to, what I see is that there's going to be a continuum from the health and wellness all the way to the medical side of it. Okay, and to me, actually, if you want to do longevity medicine, the whole healthcare ecosystem needs to evolve, because at the moment it's you get sick, right? You go and see a doctor. Longevity medicine is not about that getting sick, it's about preventing people from getting sick. So things like insurance, coverage, right? You know, going to the doctor for staying healthy, that will change, okay? And there are more and more people who are interested in this, right? Which is why I started the experiment called Bartley Clinic, which is trying to incorporate longevity medicine into primary care. Okay. And there are some success stories. Okay, not everybody who goes through the door, not every one of my few thousand patients who've signed up with me over the past 1 year has signed up for longevity medicine. But you know, at least you educate them. You educate them, and you instill the idea that actually, with this science, with this knowledge, I can stay healthy, right?
Yeah.
And hopefully live longer.
Maybe a couple that come frequently. Number one, I want the best stem cells, where can I find them, right? Or I kept looking and there's a clinic with another price. Or why Thailand, why not Malaysia, why not Mexico? So I think I just want to answer all of that with, don't compare apples with oranges. It's highly complicated.
Yes.
It really is. So you cannot just simply compare stem cell providers with stem cell providers, because you may not even know what is the stem cell type, how are these stem cells produced, what or who is the lab behind it. What you maybe not know, that most clinics use the same labs, but they have way different pricing. So you got to ask yourself, why is that, right? So with ImagineHealth, we actually work with the labs directly. And that is one of the reasons why actually our stem cell therapies are as affordable as they are. We're cutting out all the middlemen.
Yeah.
So ask questions, ask us. How do we ensure quality? How do we ensure safety? Who is the doctor administering the treatment? Is it a specialized, is it a specially educated doctor, or just a GP? Is it an aesthetic doctor, right? So all of these questions need to be asked. Some people spend more time researching cars or mobile phones than with the stem cell therapy. And that's wrong, right? And we're here to answer these questions. So don't get confused, don't make an easy decision. Or if you have a certain tendency, if you think I'm going to do this treatment with clinic ABC, contact us and we'll let you know if it's a solid offer or not. And then you have at least you have a second opinion. Like I said already, ask questions, and or maybe visit the provider in person first, right? So contact us. We'll make sure you have a sometimes complimentary consultation. Sometimes there will be a fee depending on the doctor's time. You can talk to Dr. Hisham in Singapore, who has seen various clinics in Bangkok already, who can attest. So all of this, right? Do your due diligence. Obviously, ImagineHealth, we have done our due diligence already. I've been in this space for 15 years, and when I talk to providers, I talk to the medical directors, I talk to the lab owners. So we have the inside track, so to speak, so that our clients get the best product and the fastest and best consultations.
Even if you're not in Singapore, if you want to speak to me, I'm available. Okay, as those in Singapore can either pop to my clinic, WhatsApp my clinic, email us, or we'll do a teleconsult. Those options are available. Okay. For me, an initial consult is actually free of charge. I don't charge you anything, okay, for a very short consult, okay, because what you need is to understand, one, okay, who you are going to be doing it with. I have not just vetted the clinics in Thailand, and I've visited a few, right? And I've chosen to work with ImagineHealth because I know of the standards and of the quality, right, that they have made sure that the patients get. Okay. I've also been to other parts of Asia as well, right? Many other countries that provide this. Okay. So Thailand is good. I don't provide options for certain countries, okay, we shall remain nameless, okay, because I don't find the quality there, right? So that basically hopefully answers that. Okay. Now, if a patient comes to me and says, I want stem cells, right, I will then ask them about their history, why they need it, and things like that. The selection of the patient, okay, and why they want to have stem cells is equivalent to the success, right? Okay. Not every condition, okay, right, will be cured by stem cells, right? But majority, yes. For a lot of conditions, yes, right? You know? So that selection is very, very important. And I would say that if you've never done your biomarkers, then you should do them. You know, I can provide that for you. If you haven't done your biological age, do that. I can provide that for you. Because the thing is that if you don't have a good nutrition, you don't have good sleep, you don't have exercise, you don't take the right supplementation, the stem cells will just go away.
Well, that's one reason I'm excited about our collaboration.
Yeah.
Naturally, you can come to Thailand, do stem cell therapy once per year.
Yeah.
Sure, great idea, but it would be even better if you would combine that with certain lifestyle changes and you're the man on the ground to keep reminding them, right?
Yeah.
So I think that's a great combo.
Yeah.
Do you have any particular success stories you want to share, perhaps?
I would say patients with joint arthritis. Okay. And we know the success rates for this, right? So those with really bad knees, right? Okay, stem cell therapy actually works. Okay, some liver degeneration. Okay, liver degeneration, kidney, renal, heart. Okay, to a certain extent, dementia and things like that as well, right? You know, so neurological. Now, I think not my patient. But recently, there was this 20-something-year-old who had stem cell therapy. She's diabetic, and now she's no longer on insulin. I think this was somewhere in America or Europe, if I'm not mistaken. Yeah, and that's amazing.
I mean, there's research all over the world. Harvard has a stem cell institute.
Yes.
So for anyone who's doubting the technology at large,
yes,
there's actually no debate, right?
Yeah.
So whoever has the funding is researching in that direction.
Yeah.
And what people don't realize, especially in Thailand, is we are very fortunate here to have access to these technologies.
Yeah.
And in Singapore, we have to just raise awareness and say, look, it's right there. It's a step on the plane, especially with the beautiful airport you have. It's really not that much of a time investment. I can't vouch for the Bangkok side, but at least half the journey is very, very smooth. And
it's easy. It's easy. I left at 5:50 in the morning today, and here I am doing this video, and you know,
You could do the stem cell therapy now.
Yeah.
There's no downtime. You can return back to Singapore the same day.
Precisely, and some of our patients have done that, right? You know, so the thing is that with stem cell therapy, there's a lot of, I would say, in inverted commas, cowboys out there. Okay, so you have to be careful who you choose.
Yeah.
You have to know who is going to provide the stem cells for you. You have to know where they come from, the quality, the safety, and everything else, the protocols, because there are different protocols of actually giving them, right? So this is important for your success, okay, right? So this is, just letting the viewers know.
Maybe one final comment, because it hasn't even been a topic yet. Just on the cellular level, we mentioned there are different stem cell types. So we're very fortunate to work with a lab that offers mesenchymal-derived stem cells from amniotic fluid. Commonly used is the umbilical cord blood that is collected at the time of healthy birth. Now the amniotic fluid, because it's so much younger when it's collected, it's actually much higher in potency,
Yes.
and it has pluripotent characteristics.
Yes.
That is huge. You mentioned insulin. These human amniotic fluid stem cells can do everything the regular MSCs can do. They can turn
Yes.
into cartilage, muscle, etc. But on top of that, they can also turn into neurons, heart cells,
Yeah.
insulin-producing cells.
Yes.
So they have a higher potency, and it's, to my knowledge, and I've been doing this nearly 20 years, there's only one lab in the world that does it. They have developed it together with the Royal Hospital in Bangkok, and it's only available here. And that's amazing, because this is the most potent stem cell type you could use for longevity,
Yeah.
because it actually gives you a chance to rejuvenate the whole body. Yeah, I mean, the key takeaway is Dr. Hishamuddin Bartley Clinic is in Singapore. He's a very friendly man, as you can all attest to. Please contact him, and through him we can get your longevity journey started with a baseline assessment. Let's find out what maybe genetic risks you have, what
Yeah.
your biological age is, what you should do to change your lifestyle. And that could, not always, but it could lead to maybe more radical longevity interventions abroad.
Yeah.
But we'll see what your health status is. And if you do, you do know now that there's a trusted partner in Thailand that can facilitate these treatments.
Yeah.
So we're looking forward to meet you all in Thailand. And I actually make a personal effort I try to meet every single client in the clinic. So we are very personal.
Yeah.
We don't shy away from meeting our clients, because we're very much interested in having that connection and to build relationships long term.
Very simple. Drop us a line, okay, either through email, call, WhatsApp, teleconsult, come in person to my really humble, in the middle of nowhere clinic, okay. I can even come to your house, or we will meet for coffee somewhere else, okay, for a little chat, okay. I'm open to that, okay. So, likewise, it was very fortunate that Henning, contacted me, because I was at that point where I was thinking, okay, what else can I do? How do I do this? Kind of like advanced treatments which are not available in Singapore. Contacted, I was like, this is basically a sign, right? So we started talking, and we realized that actually we think alike. We have the same objectives, very personalized and things like that. But for me, let me know what your focus is, right? Let me know, why you are interested in longevity. What is your aim? Okay, then my role is to guide you towards that. And we now have a partner, okay, not in Singapore, but a short plane ride away, okay, in ImagineHealth, that can provide the end-to-end longevity management that we require. Okay, so yeah, that's it.
Excellent. Thanks for coming.
No problem at all.